Hi, I'm Dr. LeRoy. I've been specializing in the holistic treatment of HPV and cervical dysplasia since 1995. My natural holistic treatment approach is two-part. The first part is oral treatment. Oral treatment includes dietary changes that are proven to help not only clear the HPV, but also reverse dysplasia and get a normal pap. The other part of the oral part of treatment are supplements. I use supplements that are proven likewise to help clear the virus as well as eliminate cervical dysplasia. The second part of treatment uses a solution that causes the selective death of both HPV-infected cells and cervical dysplasia. This solution is termed an escharotic solution because it causes the selective death of abnormal cells. The solution is comprised of both zinc chloride and bloodroot. For a more detailed explanation of this treatment, you can go to my website. This is it here, drnick.net. I have a detailed explanation of cervical dysplasia, HPV treatment. I also have before and after treatment images that are very detailed with explanations. And I have case studies, patient reviews, and again, a more detailed explanation of escharotic therapy. This is an example of the treatment that I do. Again, it's two-part, the oral part as well as the direct treatment to the cervix itself. This is a 31-year-old woman who had mild dysplasia as well as a high-risk HPV. The high-risk HPV are about 13 or 14 human papillomaviruses that tend to be more aggressive and are associated with cervical cancer. So she in fact had a high-risk HPV. This is at the time of treatment 1. So again, I use a solution comprised of zinc chloride and bloodroot. That solution I put all over the entire cervix and the adjacent tissue. Now you can see on this, at this first treatment, you can see that there's some kind of funky looking tissue here that's doesn't look normal. Well, this is dysplastic tissue as well as HPV infected cells. What's nice about using this solution and doing treatment is that, again, it doesn't affect normal tissue. You can see all this normal pink tissue out here, unaffected by the treatment. The only tissue and the only cells that are affected by this treatment are the abnormal cells. It's the HPV infected cells as well as the dysplastic cells. A benefit of using this solution is that it stains the abnormal tissue kind of a yellow-white, as you can see here. What's nice about that is then I know how big the area is, and then I can watch it treatment by treatment. So this is the first time we do treatment. I put the application on. We wait about a week and then we do a second application. Now this is exactly 1 week later, so you can already see that a lot of this tissue has already sloughed off. It's died and it's sloughed off. So this is after only one application of the escharotic. We can see already that this is improving. So this is at the time of treatment 2. 1 week later, treatment 2, again, I put the solution all over the cervix and the adjacent tissue. Again, it's not affecting the normal healthy tissue. Now it's affecting even a smaller area of tissue right around the endocervical canal or the opening to the cervix. Here we are at treatment 6. Again, rest of the cervix looking healthy. You can see a little bit of staining right around the canal, mostly down through here. So the area has regressed substantially. We can kind of see in the canal some kind of black tissue. Still a little bit of, there's still a little bit of cells in the canal that are being affected that are probably dying. So we're not going to quite stop here yet. Here it is at treatment 9. So I did a few more treatments in between. Now we're not really seeing any staining along the border of the canal. The endocervical canal is looking pretty good. So at this point, I discontinue treatment. We wait 3 weeks to either do colposcopy or do a repeat pap. This is 3 weeks later at the time that we did the pap. The pap came back normal. As you can see, tissue looks healthy. We no longer have this large area of abnormal tissue, dysplastic tissue, HPV infected. So again, this was at the time of treatment 1, how it looked. Here's the after at the time we did the pap. Pap came back normal. And as an added benefit, the high-risk HPV was negative, so it was non-detected. That's the goal with therapy, ultimately, is to not only get rid of dysplasia, but to get rid of the HPV. Escharotic therapy is highly effective therapy. I normally perform it once a week on most patients, sometimes twice a week, depending on how well they tolerate treatment. I do have patients who come from out of state, They either drive in or they fly in. To make it more cost-effective and affordable, what I do with those individuals is we usually do 2 or 3 treatments in a row, and we maybe do that once per month. So patient will fly in, we'll do treatment, they'll stay overnight, we'll do a second treatment. Sometimes they'll stay over a second night and we'll do a third treatment. They'll drive or fly back home, and then we'll repeat the whole process. Maybe about 3, 4, 5 weeks later, we'll do it all over again. Highly effective treatment, probably one of the best treatments for the holistic approach to cervical dysplasia and HPV.